My name is William, and this is Group 17's project work. Our project is looking at the double burden of disease in sub-Saharan Africa. Now, when we talk about the double burden of disease in sub-Saharan Africa, we are looking at the coexistence of communicable diseases and non-communicable diseases in the same or within the same population or household. In sub-Saharan Africa, non-communicable diseases are projected to overtake infectious diseases as the leading cause of death by 2030, while sub-Saharan Africa still battles the world's highest under 5 mortality rate, that is 69 deaths per 1,000 live births. 18 million people died globally from non-communicable diseases in 2021, and this shift is hitting African urban centers rapidly. Now let's look at the national trends. Fertility and mortality trends. Maternal mortality rose from 917 in 2017 to 1,047 per 100,000 live births in 2020. That's for Nigeria. But Tanzania showed a significant progress, reducing maternal mortality by 55% between 2017 and 2020. In 2020, high fertility and improved survival rates mean larger youths and aging populations. The aging group is now facing non-communicable diseases, while the youth remain vulnerable to infectious diseases. The impact of urbanization and migration on the spread of diseases. Rapid unplanned urbanization in Africa has led to epidemiological polarization. In cities like Accra, the poor face a double jeopardy: high infection risk from crowded living and rising non-communicable diseases risk from sedentary lifestyles and unhealthy diets. Migration and the study conducted in South Africa about HIV. Data from South Africa shows that as net migration peaked between 2010 and 2015, the number of children living with HIV remained high. That's 350,000, illustrating how human movement facilitates the spread of diseases. Now, the old burden, the communicable diseases or the old burden. Malaria remains a massive threat. In 2023, over 40% of children under 5 in sub-Saharan Africa were not protected by nets. Then we come to the non-communicable diseases, which is seen as the new burden. Cardiovascular diseases are the leading non-communicable diseases killer in sub-Saharan Africa, causing nearly 1 million deaths in 2013 alone. Diseases of poverty, that's infectious diseases, increases the risk of developing chronic non-communicable diseases later in life. Now, the socio-economic drivers of health challenges. We have the poverty link. In sub-Saharan Africa, non-communicable diseases disproportionately affect low-income groups who lack access to treatment. Then we have the health workforce gap. There is a severe shortage of healthcare workers. Sub-Saharan Africa only has 1.3 workers per 1,000 people, far below the SDG required average of 4.5. Then we also have the financial impact. High-income countries in the region reduce mortality rates at rate of 3%, while low-income countries struggle at less than 1%, often due to lack of health financing. We are looking at Sustainable Development Goal 3, which is good health and well-being. Strategy 1 that we are looking at is integrated healthcare. We should be treating HIV and hypertension in the same clinic to address the double burden efficiently. And our strategy 2, we are looking at maternal health focus. We should target the reduction of maternal mortality to less than 70 per 100,000 live births by 2030 by increasing skilled birth attendance, critical for countries like South Sudan with rates over 1,200. And addressing the inequality of health access, which is SDG 10. We are looking at universal health coverage. We should implement financial risk protection so that poor urban migrants don't face catastrophic expenditure when seeking care, and also equity in distribution. We should increase health worker density in rural areas to bridge the gap between wealthy modern profiles and poor infectious profiles seen in the cities. In summary, we are looking at the double burden of disease, which is Africa dealing with both infectious and rising infectious diseases and the rising lifestyle diseases. We also look at the population effect, how young people are facing infections while older people faces diseases like heart problems. We also look at urbanization as a double jeopardy, which city life increases both infection risk and lifestyle disease, especially for the poor. We looked at the maternal health. Deaths during childbirth differ greatly between countries due to unequal healthcare, yes. And we also look at the solutions that we can provide, which we said improve healthcare by combining treatments, supporting mothers, and making care accessible to all.
Good afternoon. My name is Ivana Maklai, and my student ID is 223-74612. And I was a socio-economic analyst, and I examined some specific health challenges, communicable diseases like HIVs, malaria, and some NCDs like diabetes. Thank you.
Hello, I am Gertrude Esirifi. My index number is 22414-337. I examined specific health challenges, that's communicable diseases like HIV, malaria, etc., and non-communicable diseases like hypertension and diabetes. Thank you.
Hello, good afternoon. My name is Enoch Amankwa. My student ID is 22391427. I was the one who did the introduction of double burden disease, and I made a final report of the double burden disease. Thank you very much.
Hello, my name is Jose Emmanuel Jesse. My index number is 22400-626. My part in this presentation focused on the strategic framework on how we move SDG 10 from theory to practice, which is reduce health inequalities by focusing on financial protection, digital access, and logistical innovation. Thank you.
I am Marian Ajwa Ishin, student ID 224-11966. I served as a strategy developer for SDG 3. My work involved proposing actionable strategy tailored to the African context to ensure we meet our goals for global health and well-being. Thank you.
My name is William Saweniseba with a student ID 22371041. I am the demographic analyst, and I analyze the mortality and fertility rate in Africa, and also how it helps in the spread of diseases, that is communicable and non-communicable diseases.
My name is Ansa Christiana Abna, student ID 2241150, and I served as a migration analyst and analyzed how migration and urbanization has impacted the spread of both communicable and non-communicable diseases.